my kid was born at Mount Sinai. So they have a very low MRN number, which they find amusing. And then around 3 years after that, in the summer of 2009, my kid rotated through the emergency department 3 different times. Uh, the end diagnosis was a whammy. The short story is that my kid was diagnosed with a rare autoimmune disorder, a kidney problem, and was in the hospital from basically July 5th to September 11th of 2009. The longer story is that the autoimmune disorder, known as, sit down for it, secondary hemophagocytic lymphohistiocytosis, was treated with 40 weeks of chemotherapy, steroids, and immune suppressants. And their kidney problem was basically that their kidneys failed. And while they were an inpatient, they had plasmapheresis and dialysis back to back. So that was like 6 hours hooked up to a machine. And then after they were discharged, about a month later, my husband and I realized that the kid was looking at their little board books like this. And we were like, what's going on with that? And we got a pediatric ophthalmologist on board, and they had said, well, it seems like your kid has blood clots in the back of their eye and that their optic nerves are damaged. The blood clots might dissipate over time, kind of like the way a scab on your knee, dries up and falls off and is okay. But the optic nerve damage is permanent. I think for hospital staff who are interacting with families, I think openness is my one word, my one piece of advice. Open ears to hear what the parents and their kids have to say, open minds to think about what diagnoses or what diagnosis could this patient have, what tools can we use to improve the health of this patient, and open hearts to be empathetic towards the young patients and their parents and guardians to what they're going through. I know, and you do too probably, that the staff in the emergency department are very rushed. There's a lot of things that they have to do from here to there, this patient, that patient, this procedure, log in, order meds, whatever, right? But whenever a doctor or a nurse came into our little curtained bay, I felt like they were there for my kid and I, that they must have like taken a breath and said, okay, we're here for this patient. We're listening to what this patient has to say. I am focusing on what is going on in this emergency bay, not what's going outside. I am not thinking about the next thing. I am here. I am present. And I think I felt that change. And it's not tangible. I can't say at 16:0300, I noticed Dr. blah, 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 right? I don't know that they took that breath, but I could feel that they were there for me and my kid.
My name is Kayla Collins. I'm 21, and I've been followed by Mount Sinai Kravis, the hematology department specifically, for pretty much all 21 years of my life, for sickle cell anemia. I've had sickle cell disease since I was born, and I've been in and out of the hospital multiple times a year for my entire life. And I think in general, my experience has been a very long and challenging process, but I think hospital speaking, like being admitted, I think it's been the most welcoming, comfortable, positive experience as an admission can get. As you're growing up in the hospital and like becoming, a teenager, but then adding on that layer of like becoming a teenager in the hospital with a chronic illness, I think what went really well for me was my team like enabling me and like helping me find my voice within all of that. Like they would lead by example in the beginning, I think, when I was a little bit younger, when we would be like in the room with the doctors and they would kind of like ask more of like a leading question for me to like give me the room to step in. I think just that entire process of learning to speak up for myself and like speak for myself. I think I was like 14, 15 maybe. I was having my gallbladder surgery. And the day before my surgery, we had our like team meeting kind of, and they were like briefing me and my family on what was happening. But however, I think it didn't particularly go well for me because I feel like while we were being like talked about, like briefed on what was going to happen, I feel like I was entirely left out of the conversation. And as the patient who was going into surgery the next day, it was a horrible feeling. It was like terrifying. And I think a lot of it has to do with it was like a bigger procedure. It was because I hadn't really had a lot of surgeries prior to then. Like nerves were high on my family's end, I guess. Um, so I guess like somewhere along the communication, I just kind of got overlooked. I think overall, what just didn't go well was the fact that like it was like as if I kind of didn't matter despite the fact that I was the patient. I felt like everybody was trying to inform and like relax everybody but me.